For me, I've always seen myself as Hmong and queer, and like, I think people see you as one or the other, but not ever being both at the same time. But actually, both identities really impact who I am. Yeah.
Health and healthcare is such a multifaceted, dynamic concept to me. It doesn't just encompass your physical health, it encompasses your social health, your psychological health, your emotional health. Being a member of the LGBTQ community does really impact all of the above.
I think body dysphoria is real. And once I worked on my mental wellness, I was able to focus on, hey, I want my body, like I actually need my body to be this way to survive. And it's not a choice, it's actually how I feel. And that body dysphoria actually impacts my mental wellness. And mental wellness is a sickness, you know, and I think that's what people don't see. Like, if you have a cancer, you would, I don't know, you would go for chemo, right? If you had asthma, you would use inhaler. If you have depression, you would work on the things to make your depression better. And so it was a sickness. I didn't want to die, you know? Like, I wanted to live how I wanted to because I didn't want to die.
LGBTQ plus youth have a 1.5 to 3 times higher suicide risk, and that's just something that people don't talk about. People don't realize the stigma and the effects of the stigma that it just has on somebody's mental well-being.
And finding the right therapist is another hard thing for me. I prefer somebody that looks like me, that can understand me, that knows more about like queer folks and how like their mindset is after like a lot of trauma.
A lot of times I just felt like I had to explain my experiences more. Like, I had to explain what I felt to justify so that they would understand what I'm going through. And I think that was a big struggle for me.
As you step foot in the hospital as a patient and you don't know who you're going to meet, you don't know what biases people might have about you and your family. And that's terrifying. It's terrifying, and it's very hard to deal with. And so you just hope that that person that is going to be caring for you can take a step back and have you maybe explain who you are, maybe to talk about what your pronouns are, and how you identify and who your spouse is or your partner is.
Personally, for me, I just changed my name, and there was a name that I didn't want to go by, and they would have like my name and then in a comma like my preferred name, but they wouldn't even look at the preferred name. I always get like this gut feeling of like not being respected for who I am. It feels like when somebody misgenders me, like calls me he or him instead of she, her. So I always like, when that happens, like I just shrivel down into like my body, and then probably don't say anything until like I'm comfortable with saying something.
I know myself, it was very hard going into a hospital when I had my 2 children. My wife carried one and then I carried one. Dealing with the birth certificate is still a huge problem in Wisconsin. The worksheet that we have people fill out is very much father, mother, mother's information, father's information, baby's name, and people have to put whomever they would like to have on there. Like if you have a gender nonconforming spouse, who's picking what to put where? That is a really sad thing that people have to fear about, how they're going to identify who is legally able to have rights over their child.
So I donated a kidney on October 30th of 2019, last fall. And when I did my workup, my sexuality was questioned right away. It's part of the pre-screening, just like you can't donate blood as like a gay male. You're not supposed to be able to donate kidneys or organs, whatever, unless you're accepted as a high-risk donor. So the family had to accept me as a high-risk donor without knowing who was donating, knowing why I was high-risk. I could have been homeless, an alcoholic, an IV drug user, someone on chemotherapy whose organs might have been damaged by medication. But it was me, a 23-year-old healthy male who's conscious of my health and takes good care of my body and my well-being. So that was just really difficult. I felt like a good deed that I was trying to do was kind of being inhibited. I wasn't able to do something to improve the life and give life to another human just because of my sexuality, which was difficult for me to accept.
I didn't know that health actually really is a big part of being trans, and especially for someone who wants to surgically transition. Having to slow my transition for 4 years because I didn't know where to go or what to do, and I think that was like it was really hard to navigate the health system, I guess. And like nobody knew the language. People were like, "What's top surgery? What is that? I don't know what you're talking about. Is it breast reduction?" You know, and I think the lack of like people knowing what surgery is or like transitioning is.
I think we should talk more about sexual health or education, because I honestly, for a couple of years, I didn't even know there was condoms for women on women. And then I was like, there was a condom. Like, how does that work? And so that was never explained in sex ed. That was never expressed to me in the doctor's office.
I think outreach is a big problem. Being in community and caring about people, it's like, hey, and doing outreach, like, hey, this is like, if you're interested in transition, this is the process and this is how it goes. But actually going out to those communities where queer and trans people are, you know, and let me put it in these words. I wish that when I was 19, if someone would have told me, here's a brochure on how you can get top surgery, and it's like really easy to read, you know, like easy language. You have to get this letter recommendation, you have to go see therapy, and you have to do this and that, and then boom. If the Hmong grandmother understands it and the 5-year-old kid understands it, then you're good. You know, content that's available to everybody.
Health is the foundation of a strong society. Health and education, and without health, there's nothing. There's no hope to obtain an education. There's no hope to advance, to add to society and give back to the community that you're a part of.